All right. So let's talk a little bit about what is the HOPE protocol for her and why is that important. HOPE protocol for her is when we look at the whole picture for a woman's sexual function. There's no doubt that hormones are super important. We're all a living proof of that through the years. Organ health, not just vaginal, but clitoral sensitivity is super important. We'll talk a little bit about that. And we'll also be talking a lot about pelvic structure. We all know that the primary nerves that go to the bladder, to the urethra, and to the vulva, and to all the sensitive areas for women are coming out of the lower back and the sacrum. So therefore, having a healthy pelvis is going to be super important for us in order to have normal sexual function. And no doubt about it that the emotional health, and I'm not talking about, psychotherapy here, I'm talking about even the effects of neurotransmitters, which are the little particles that get made in our body that rule our brain, and they also rule hormones. So we'll talk a little bit about that as well. Sexual health is super important, and it is a way that we share with the people that we love, and being intimate with each other is extremely important. And the age is not important, because even when people are getting older, sexual health should get even better and not worse. So let's figure out how we can do that. I wanted to give you a few statistics about some of the things that affect a large majority of women. And I can tell you one thing, that when women are incontinent, it's going to really take away from our ability to be spontaneous about our sexual activities, and it's going to embarrass us. It's also going to interfere with some of the clothes that we're going to wear. We start wearing black clothes. We don't like to wear white because it could show through. All these things are going to make us feel less sexual, less attractive. And so much of women's sensuality and sexuality is how we feel about ourselves and our image. There's no doubt that when you look at the statistics, 13 million Americans are incontinent. I can tell you that that's very conservative, and that you can multiply that number by 5 at least. Most of the people that are incontinent tend to be women. About 80% of them are going to be women. But what's fascinating is we think that this affects only older women. Well, that's not true. The average age is 48, and there's some teenagers out there who are already having some issues with incontinence. It's thought that only 1 out of 12 women will ever talk to their doctors about it. And the reason for that is that we feel that since this is something that affects most women, why, let's not talk about it, let's not deal with it, we'll just suffer with it. And I'm here to tell you girls, don't do that. There's no need to suffer. The only need here is to have a beautiful sexual life for the people that we love. Another good thing about what we're going to talk about is some of the concepts that we talk about today help also with chronic pain, which, as you can imagine, if you have chronic pain every time you have intercourse, that's not going to make sexual pleasure very, very good. So let's try to figure out how we can change that. Let's just play a little bit with true and false. This is going to be how many true or false. Physicians and other healthcare practitioners see urinary incontinence as a medical priority and often ask about it in their yearly checkups. And this is false. Most physicians right now only have 5 to 10 minutes, and they're hard-pressed to ask about anything like this, primarily if you have other medical issues like heart and diabetes. True or false? Stress urinary incontinence only affects older women. Stress urinary incontinence only affects women who've had vaginal deliveries. False on both accounts. Stress urinary incontinence can affect younger women. And even if you've had C-sections, or even if you've never had a child, you can still suffer from incontinence. There's a lot of good things that we can do with urinary incontinence, such as the Kegels. We're all familiar with Kegels, biofeedback, etc. But what is one of the reasons why women start having less sensitivity in the vaginal area, less sensitivity in the clitoris, And also, why is it that we end up leaking urine? I mean, that is kind of very annoying. The reason being is because we do have the nerves, like we were talking about, going to the bladder, the urethra, and the sensitive areas of the clitoris are through the lower back. A lot of women, as they're having children, they're going to have back issues. A lot of the ligaments, as you can see here, this is the pelvis looked at from the back. This is the sacrum, and all those letters that you see, A, B, C, those are the ligaments that will get very lax when we're having a baby. Otherwise, we wouldn't be able to have a baby. And then it's very difficult for those ligaments to come back together. All those little holes that you see there, those are the areas where the nerves that are going to the vulva, to the clitoris, to the vaginal area, they're moving through these little holes. So if the sacrum is unstable and the ligaments are goosey-loosey, it's no wonder that the nerves that are going to our sensitive areas get affected, and therefore we can end up having very poor vaginal sensitivity, vaginal dryness, and even pain in some cases. You also see here from a bird's view the muscles that have to do with the pelvic floor. A lot of us now hear about core musculature, and we know that it's important to strengthen our abdomen and our back. But remember, we also need to strengthen our pelvic floor. The pelvic floor is the urinary sphincter, is the vaginal sphincter. So as we work in improving the health of the pelvic floor, we're going to be able to sense more. We're going to be able to engage our partners and have more of a vaginal strength to hold. So vaginal strength and vaginal pelvic floor function, all of these things are related to a very healthy pelvis, which is related to structure. How do we test in our office for structure? We use thermography, which is not radiation. There's no radiation whatsoever. It can really help us identify those parts of the lower back or sacrum that are being affected. And remember that the sacrum and the lower back are being affected sometimes because we may have an injury to our knee, or we may need a knee replacement or a hip replacement. Anything that is going to help us, that is going to cause us to walk unevenly, is going to affect the sacrum. So having children is not the only thing. Having problems with our structure, like in the lower legs, it's also going to affect our function. So when we are trying to help somebody figure out why are we having trouble? Is it just libido? Is it just desire? Or is it something structural? Is it hormones? We like to look at the whole picture for anybody that walks in the door for us, and we're going to look at all these things for each one of the people. Female sexual health, once again, can be super important. And one of the things that's been gaining a lot of popularity in the media is the O shot. The O shot is essentially when we use platelet-rich plasma, which is we isolate it from our own blood. We collect the blood, we process it in a way where we collect all the growth factors that are found in the plasma. We concentrate them, and then we're going to put those around the urethra. Sometimes we put it in the clitoris, to improve the sensitivity, to improve the health of the tissue, to improve the function of the tissue. What's good about platelet-rich plasma is that it's from your own body, so you don't have to worry about allergic reactions. You don't have to worry about infections or anything else that could be carried by some other people. There's no chemicals with it. The other nice thing about it is that it is a liquid, so it can be easily put with a very fine needle, the smallest needles that we can find, so people don't have many complaints about pain. And those whole things are very important. There's never, it's been used for 20 years. It's been very well known for orthopedic injuries. A lot of people used to travel to Europe to get their joints injected. Thank God now we don't have to do that. We have access of that in our country. And it's been used for about 20 years. And honestly, the only side effects that you could ever associate with it is like anything. Anytime you put a needle anywhere in the body, you could have a little hematoma. You could have a little bit of itching, but there is really no complications whatsoever. The worst thing that can happen is that it may not work, but it's really not going to cause you to have any bad reactions. There's no doubt that if people have cancer or they have chemotherapy or some other problems with with their blood, we're not going to want to concentrate growth factors from that blood, and these would be people that we would not be doing platelet-rich plasma for. What's really cool about platelet-rich plasma is that it continues to improve. Like we always say, there's a rule of 3 days, 3 weeks, and 3 months. But there's the remodeling process, people are saying it can last 1 to 2 years. And what that means is that if we can produce new blood vessels in whatever area we're injecting the platelet-rich plasma, that there is no doubt that that's going to improve the health of the tissue. So in reality, unlike other techniques where you do it and with time it gets worse and you lose effectivity, with platelet-rich plasma, you do the opposite. You start improving reliability with time. Other things that we sometimes put in with the platelet-rich plasma is going to be stem cells. And we're now starting to use stem cells collected from your love handles, and we can actually translate into stem cells and put them in areas of your body that can improve. In the case of our women, as you can see in this picture, we're going to put it around the urethra, and we're going to then have that area get thicker. Stress incontinence goes away with these injections. More important, the thickness of the vaginal wall gets rejuvenated. It gets healthier, thicker. The muscles are going to also get stronger. And so it really takes us back about 10 to 15 years of rejuvenation. On top of that, we have been using the shockwave. We've been using shockwave to break kidney stones for the last 20 to 30 years, or probably even longer. We didn't realize that that same technology used in the smaller, affecting smaller areas was also a really good way to improve the health of the tissue, bringing new blood vessels, improving lymphatics, improving, all kinds of thickness of the tissue. Once again, after it was used with kidney stones, it's now being used quite a bit with musculoskeletal issues and improving ligaments, improving muscle tissue. And so it works exactly the same way when we do it vaginally, and we help women improve the strength of the pelvic floor muscle, so that way they can squeeze and they can stop their leakage, and more important, they can engage with that vaginal strength. It's also used in men, of course, for improvement of their erections and treatment of Peyronie's disease. When you combine, and this is the little shockwave that we use for sexual function and improving blood flow into both the penis and the vagina. For those of you who are a little bit worried about pain, know that we use acupuncture, ear acupuncture sometimes to help with that, as well as very strong local anesthetics. I think the coolest thing about this whole process, when we do the O-shot and we're either injecting platelet-rich plasma or stem cells, or we do the shockwave, or we do all of the above, is that people always say, oh my God, I was so worried, I thought it was going to be painful, and this was nothing, I could barely feel it. And that's what we like to hear. The last thing we want to do is make you guys have any pain. The other thing that we feel is super important is to send women home with the electrical stimulator and biofeedback. And this is what the Apex pelvic floor apparatus looks like. We send you home with one of these, and we teach you how to use it. I have been using electrical stimulation and biofeedback for vaginal health probably for the last 20 years with excellent results. The nice thing about this is, once again, it's going to be a stimulus to bring the nerve endings to reconnect with the right areas in conjunction with the stem cells. Having that constant stimulus is going to help the body reconnect the brain with a neurological function and help us reinnervate the area of the clitoris and the vagina. So it's not just about improving blood flow, but it's also about improving nerve function. Lastly, emotional health and neurotransmitters are important. There's a lot of poor women that have been put on antidepressants forever, when in reality, we don't need antidepressants. We just need the precursors to some of our own neurotransmitters, such as like serotonin. Serotonin is the most common neurotransmitter to be affected in women, and is usually also associated with poor timing and resolution of our orgasms. And what we really mean by that is that it's very difficult to reach a climax. And so if we can actually provide the growth, kind of like the building blocks for the body to make their own serotonin. These can be extremely important. Women having that passion back is not just about the estrogens, the progesterones, but it's also about having the little molecular, particles in our brain that is saying, hey, let's live again. Let's kind of be involved. Let's get that thirst for life that we've been missing for a while. Dopamine in women, it's also associated with desire. So if we have a low dopamine level, our desire is not going to be there. We can give you hormones until we get crazy levels, but it's not going to make a difference. So we can't just rely on hormones alone. We have to be more sophisticated in our treatments, and we have to identify which neurotransmitters are going to be lower on you. Is it serotonin? Is it GABA? It's a dopamine. And if we can balance that out, then we can really improve not only you being able to have an orgasm and the quality of the orgasm, but also just having satisfaction from that orgasm. And then lastly, let's talk a little bit about hormones. I always think it's interesting that whenever we get put on hormones, everybody puts us on the identical same hormones. There's as many types of menopause as there's women out there. And I can tell you that one of the things that was the kind of eye-opener for me years ago was realizing that indeed there's 12 different types of menopause. And I always joke with my patients and I said, women, instead of being criticized for our hormones, we should get a medal every month, because every day of our lives we have a different hormone being up or down. If you look at us, sometimes we have a peak in estrogens, the next time we have a peak in progesterone, or the next time. So every day of our life we have a different level of hormones. So it's a miracle we're as stable as we are, and we should be very proud of ourselves. The truth is that hormones are super important. It's not just about libido and having the desire to be intimate, but it's also, I think it affects so many aspects of our lives. It affects our hair. It affects how our skin. It affects how we interact with other people, whether we're being sitting at home, not feeling like doing anything, or being out there, trying to experience life again and trying to share it. So balancing our hormones is extremely important. And balancing our hormones should be done even before we ever go into menopause. When you look at us, a lot of women nowadays have 4 jobs. They're mothers, they're wives, they have a job, and they're daughters, and they're trying to take care of their parents, and they're trying to take care of their children, etc. So we really need to support this in order for us to transition into a very healthy perimenopause and menopause, so we can actually live through it and not just exist through it. So the most important thing for us when we see anybody in our office is to try to determine, are you the person that is estrogen dominant, or are you progesterone dominant? And how are your testosterone? And depending what your levels are of testosterone versus estrogen versus progesterone, you can be one of the 12 different types. Once we know which type you are, then we can be more specific about prescribing the proper bioidentical hormone that is specific for that woman. Some people may not need estrogens. Some people may need more estrogen. Some people don't need neither estrogens nor progesterone, but need a touch of testosterone. I think what I'm driving at, and you're all seeing it right now, is let's be specific. Let's not just use the gunshot approach or the cookie cutter approach. Let's truly look at each woman as an individual. Let's help them identify where the root cause of the problem is, so we can tackle it at that level. We want to be precise. We want to be a laser, not a shotgun. The other hormones that are super important for women, and if you know, a lot of women are thyroid, hypothyroid. Thyroid is super important in our, once again, in our level of energy, in us, in our weight, keeping our weight down, being slender, having that sense of pride of our muscle ratio. Is not just about testosterone, it's about thyroid function. And then cortisol, we all know how we're all under stress. We're always rushing from here to there, time to take the kids here, kids there, let's go shopping for food, etc. high levels of cortisol for long periods of time is really going to affect our menopause, our perimenopause, our periods. So when we look at things, we can't just look at progesterone, estrogen, and testosterone. We have to look at your thyroid. How are you doing with cortisol? And then lastly, adrenal function. And some of the adrenal hormones that are best known are DHEA. And we know that the adrenals are super important in how easily we're going to go from perimenopause to menopause, and even during our childbearing ages, etc., is going to be very adrenal dependent. If we're fatigued because we're burning the candle at both ends and we don't support the adrenal glands, and that can be with herbs, it can be with lifestyle, nutrition, etc., we're not going to be able to support the ovaries when they start going through the changes. DHEA in women can turn into estrogens. So even when we're becoming estrogen deficient, if we support the adrenals and give you some herbs that can do that, very likely you're going to go through a perimenopause that is going to be uneventful, and you're going to be doing really well. And the same is true with pregnenolone. Pregnenolone, in my opinion, is a very important adrenal hormone that is a precursor to progesterone. It's going to help you with brain. It's going to help you with memory. It's going to help you with sleeping at night. And it's super important, not just as a precursor, like I mentioned, for progesterone, but on its own, it has some very potent and powerful properties that can help us not age, not go into, dementia, and maybe even prevent Alzheimer's and the cognitive changes that we see during menopause that can be very debilitating to all of us. So this is just in a nutshell, a little bit about what the Hope for Her means. In reality, is an opportunity to do a kind of a thorough investigation of where you're at, where you want to be, and how do we get you there, and how do we make it specific to you and not, to the rest of the world. So this is it for tonight. If you join us in about 2 weeks, I believe, we're going to do the same for Hope for Him. And we're going to be giving you some information and things that can be helpful for our buddies, our partners, in improving their sexual life, because it doesn't do any good to improve just our own sexual life. We need to bring along the people we love so we can share that with them. Thank you very much. I'm going to open this up to questions. Please, you can type them up, and you don't have to say your name. Don't worry, we're not going to divulge your name. And we'd be happy to answer anything that you have in your mind.
I have another question.
Okay, you guys are letting me out easy again. There's no questions. So if you have questions and you're, afraid to ask them or whatever, give us a call. We'll try to answer as many as we can. And our phone number is 303-554-4444. Thank you very much for spending a beautiful half hour with me, and I'll talk to you soon. And no matter what, have a great sexual health with the people you love. Talk to you soon. Bye.